My name is Tom Ellis. I'm 76 years old, reside in Columbia, South Carolina, married to my bride of 53 short years. I have 2 wonderful married daughters and 5 special grandchildren. I run the Professional Insurance Agents Association of South Carolina. I play golf, and I'm an active member of the Shannon United Methodist Church. What led to my ankle replacement was I had had my knee replaced, and I knew that my ankle was giving me some problems. And I knew when I walked a lot, I would start favoring my ankle. And I knew after my knee had been replaced, it was important for me to walk like I'm supposed to walk, not favoring one part of my body. But the surgeon that did my knee replacement advised me he had somebody in his practice that could do ankles. And thus I went and talked to Dr. Benjamin Jackson about getting my ankle replaced. And he's the one that told me about the procedure.
So Mr. Ellis had an interesting condition. He had really severe ankle arthritis. The type of arthritis he had was actually due to instability of his ankle. So instability is what people talk about as giving way of their ankle. So when the ankle kind of gives out over time, or some people have repeated ankle sprains. So essentially the ankle joint, instead of functioning and staying tight as it should, got loose over time, which caused really bad arthritis of his ankle. When arthritis gets very severe of the ankle, there really only have a couple options for that surgically. There's either an ankle fusion, or what Mr. Ellis liked to have was an ankle replacement. Some of the benefits of an ankle replacement surgery versus an ankle fusion surgery are that you're able to keep motion of the ankle. The technology and the implants really improved, so people can have very successful outcomes with an ankle replacement, giving them the benefit of excellent pain relief, but also the benefit of ankle motion, which allows them to turn to a lot more of their activities which they like to do.
The recovery period lasted approximately 8 weeks. The first week I was in recovery, they put a soft cast on my ankle. The second and third week, they put a hard cast on my ankle. Then after that, I wore a boot for 5 weeks. The pain was not there at all.
We do most of our foot and ankle surgery at Park Ridge Hospital. I think we have a great team from soup to nuts. We have a great preoperative care team that knows how to provide the appropriate care before surgery, make sure you're on the right medicines, you've stopped the wrong medicines. We also have a really phenomenal anesthesia team, which I think really provides not only the care intraoperatively, which is what people think about most frequently, but also really skilled in regional anesthesia. So at Baptist Park Ridge Hospital, it's one of the busiest locations for foot and ankle surgery anywhere in the state of South Carolina. I tell folks, it's just how you want surgery to be. It's uncommon for you, but very common for us. Because of that, we're able to deliver really excellent care to our patients. Not only do we have therapists in the hospital and nurses that are trained to take care of major joint reconstruction patients, such as hip and knee replacements, but also ankle replacements, which are much less common operations. Then we have a great team of physical therapists at many of our facilities that can help you make sure you get back to that standard that you want to get to.
The care that I received before, during, and after my surgery by Dr. Jackson, his team, was a 10 plus. They answered all my questions. They explained the procedures to me, what I could expect. They did a very good job of reassuring me that they would take good care of me, which they did. After my ankle replacement, I have been very active. I'm playing golf again. One of my golfing buddies has told me that the Ellis walk, which I used to limp around in favor of my ankle, is gone. So that's a result of my ankle being replaced. I can walk like I'm supposed to without favoring any part of my body.